Good evening, everyone. Welcome to another episode of Terror Stories Talk. I am your host out of Virgin Islands, Shayna Smith Archer. And on behalf of the hosting team, Shirley Osborne from Montserrat and Thomas Christopher Famous out of Bermuda, I want to greet everyone. Thank you for tuning in, whether it's TV, radio, or online on our Facebook and YouTube channel. Thank you very much for being here with us. Tonight, we have a very interesting topic. As you know, here on Territories Talk, we always love to bring topics that we feel will empower people, and especially in the area of health and wellness. So I have with me tonight my very good friend, all the way back to high school. That's how far this goes.
Class of 93.
Arliene T. Penn. But before I have her, give a further introduction, I just want to say thank you to our media partners across the region. We could not do this without you. Cayman Mall Road Facebook page, Radio TCI, Montserrat ZJB Radio, Virgin Islands CBN Radio, FM 90.9, Bermuda's Channel 82, Radio Sabre, PJFE FM 93.9, and Barbados' CBC Channel 8. Thank you again for being on board and helping us to inform and unite our overseas territory and Caribbean family. So, Dr. Penn, I guess we should explain the doctor before we go any further, just to make sure. So, as part of your introduction and sharing with our audiences who you are, tell them about who you are.
Okay. Well, good. First of all, let me say good evening to everyone. And my sister, my classmate, Shayna, thank you for just having me as a part of the Territories Talk. It's a program that I always look forward to from week to week, because you're always hearing and learning something that's new. Who am I? I am Arliene T. Penn. I am a doctor of philosophy in public policy and public administration. No, I am not a medical doctor. I am a doctor of philosophy, and I love policy. I love policy. Back in a different life, I used to sing calypso, and in singing calypso, one of the things that I used to really love, where I would go from community to community to hear what's happening in the community, and then you would bring those issues to the forefront. But I would consider myself to be an ambassador. I'm also a person who is very much keen on mental wellness, reproductive wellness, also physical wellness. And a lot of those things, my interest has happened because of the experiences that I've had. And I believe that when you have an experience, it's important that you share it. So that's why I'm here this evening to talk about my campaign, No Fix, Live, Win. I've been pushing this campaign now publicly for the last 3 years. And because I am a 20-year cervical cancer survivor, but I would prefer to say I'm a 20-year cervical cancer thriver, because when you're thriving, it's mean that you're still moving, you're still living, you're still doing the things that you want to do so that you can live life. So it's celebrating life, no, fix, live, and win. And I'm also happy to say, as part of my introduction, Shayna, that I am the first Virgin Islands icon, because as a result of this same campaign that we're going to talk about this evening, and the Virgin Islands icon, for me, it said a lot in terms of, we had it on our territory day, or Virgin Islands Day, and it said a lot in terms of who we are, where we are. It's a reminder that we have very, very talented people, not just in the Virgin Islands alone, but across the world. In the Caribbean, we may be small, but as they would say, with Talawa, we make that large footprint to the rest of the world. So I'm happy to be here this evening so we can have a discussion.
Awesome. I think, that's a good place for us to land and start. So as you said, again, you're also the public officer, minister of the gospel,
I
and
am.
a very active citizen in your community. Let's talk about how the platform, I guess, was started, because I believe it was with when you was Mrs. British Virgin Islands, about, that was what, 3 years ago?
2022 and 2023. So I actually served
Yeah,
for
for
two
2 years.
years. Yes,
Okay.
but I'll say that the campaign actually started, Shayna, in 2004. It
Okay.
started in 2004 when I was going through my own experience with cervical cancer. When the doctor said to me that, you have cervical cancer, and you definitely have to make sure that you get the treatment that you need. I didn't even know what cervical cancer was,
Mm-hmm.
because
Mm-hmm.
I was in my early 20s, so I had no clue what it was. I had no clue what would cause it. I just had no clue. But at a very young age, because I had to go through the cervical cancer experience, I had to fly out to the Dana-Farber Cancer Institute, because I think it was important for me to be in a environment that was very
Mm-hmm.
much familiar with my situation. So I believe that if you want the best treatment, it's important for you to go and get the best treatment. And what better place for me to go than a cancer hospital that
Yes.
specialized in the area. So I went to the Dana-Farber Cancer Institute, and that's where I really, really learned more. But one of the things I want to say here, so that I can stick a pin, is that whenever you're going through an experience, whatever illness that you're going through, whatever sickness you're going through, whatever experience that you're going through, sometimes it's very important for us to understand what we're dealing with. And sometimes we don't read, and we need to read to understand. And when I went to the doctors, that's one of the first things they said to me, because I was very au fait about what was happening. I knew what the different procedures were. So that I remember the doctor saying it made it quite easy for them, because I came there as a person who was aware of
Yeah.
what was happening, because the more aware you are, the better the treatment options would be, because you can have that conversation with them instead of I have to leave
Yeah.
and come back and try to figure out
To
what it is.
understand.
Yes,
Yes. Yeah.
understand. But as I
Mhm.
was going through the experience, Shayna, there were so many different things that I had to contend with as a young woman. One, the treatment that I would have had to go through would be that of a hysterectomy at a very young
Mhm.
age. And I had two boys. I had two boys at the time. They were very young boys, probably what, five and four,
Mm.
or 6 and 5,
Yeah.
somewhere
Mhm.
around there. And I just had to get up and go, because I wanted to live. Because during the time, you would often hear if a person had cancer, the ultimate was always that's your death
Mm.
sentence.
That death sentence.
Yeah,
Yes.
yeah. Sometimes they kill you before even
Before you stop breathing. Yeah.
before you even go through the treatment. So
Mhm.
I wanted to. One of the reasons for me leaving, it's because I didn't. One, I didn't want the pity, and two, I wanted to make sure that I was in a place where I can get the best treatment possible.
Mhm.
And it's only when I went to Dana Farber, that's when the day, I think it hit me that, oh boy, at this young age, you're going to be losing your womb. You're going to be losing your womb. You're going to be losing the cervix. But before that, I would have gone through some treatments before, but they didn't.
Mhm.
I had to do in-office surgery, one that would have left me with an incompetent cervix. It meant that they would have done a cone biopsy, but it would have left
Yeah.
me with an incompetent cervix. It meant that if I were to get pregnant, then they would have had to sort of suture, give me the stitches to hold the baby on the inside. But that surgery, it wasn't as successful as we wanted it. And then
Mm.
one thing led to the next. So then I ended up with the cervical cancer. But going through that experience, I realized that that's when I started to talk to others. When I'd gone through the hysterectomy, gone through the treatment, thankfully I didn't have to go through the radiation or chemotherapy, because I'm a firm believer now, even more than ever, that early detection it saved lives. And see what happened. I'm still alive. I'm still
Mm-hmm.
alive, so that I can live to tell the story. But what
So,
happened
quick question there, right? You're talking about that. What prompted you to even go and possibly, have that pap smear done? Was that part of your annual, or were you experiencing symptoms?
okay, well, what prompted me was there was this local clinic called the BNF Medical Complex that
Mm-hmm.
it was during Mother's Day, the mother's that Mother's Month of May. They had a free pap smear screening for women.
Okay.
And I remember I was working at the radio station at the time, and I did the commercial. And in
Okay.
the commercial, I said, no, well, let me go, because
Mhm.
I don't think there's anything wrong anyway.
Yeah. Yeah.
When I went, and then I remember when the doctor called me and said, this is what it was in terms of, at the time, it was squamous cells at the time, so it wasn't
Okay.
cancer at the
The
time. It was
early
just squamous
stages. Yeah.
cells, yes, like precancerous cells, and where you could be treated in
Hmm.
in the regular clinic, the regular
Okay.
hospital. You go in today, come out tomorrow, because there are
Hmm.
some little procedures that they would do, like the cone biopsy or the scrapings. So there are little
Okay.
things that they would do so that you would revert back to normal. But
Yeah. That
um,
doesn't
I
always
wasn't
happen in
paying.
each case.
I
Yeah.
wasn't paying attention, when I was, because it was successful.
Yeah. Okay.
I still went on living life.
Hmm. Hmm.
Wasn't paying attention, and I'm a young person. I wasn't studying anything like that.
Yeah, you live in your best.
Yeah. And then
Yeah.
during that time, Shayna, if you remember, in those times, 2001, 2002, 2003, I
Hmm.
am calypso. I'm singing calypso. I'm popular. You see
Yeah.
what I'm saying? Because so I'm
Yeah.
I'm doing I'm doing life. I'm a public figure. I'm singing the calypso.
Yeah.
I'm winning the pageants. So I
Hmm.
didn't have time for those
For your
things.
health. Yeah.
Yeah, you
To
see what I'm saying?
have that prayer.
No, I didn't. I didn't have time for the health.
And I
And
think that's one of the things that I appreciate about your platform in terms of having gone through that experience so early. Because again, for you and I, we would have heard about, persons who are probably, our mother's age
mhm,
experiencing these types of things.
yes,
So we figuring at our age, we're in our 20s and our 30s, we're thinking, all is well until we get somewhere
yeah,
past 40, 50, then we have to start to pay closer attention, not
yes,
realizing that, we from any age, again, your reproductive health can be affected adversely. And we always have to be, doing our checkups and seeing what's
yes,
happening. That's why,
yes.
even what BNF was doing was so valuable because essentially, that started the process of saving your life.
Yeah, and I didn't have insurance at the time. I didn't have insurance at the time. So, when you have to think about, if I am, at the time, I was making about, I think it's $450 a month, and my rent was $400 a month.
Wow.
So if my rent is $400 a month, and thankfully my electricity was about 30 something dollars a month. So sometimes I used to work overtime so that you
Hmm.
can get the extra monies that's coming in. And if I have to weigh the pros of making sure that, mm, I'm going to weigh things in the balance, where instead of eating perhaps the fruit, I'll probably eat the
Yeah.
sausage. you
Hmm.
know so there's some things that I really had to weigh in terms of bad eating as well. And then I can't rule out the HPV, the human papilloma virus, because this is the first time even going through that experience when I was able to learn about those things, in terms of, there are things. What causes cervical cancer would be STIs, sexually transmitted infection. And sometimes you don't even know whether or not, because I think it's 16 and 18 would be the two that ends up becoming the leading to the cervical cancer. So these are things
Hmm.
that I perhaps was not looking for or thinking about.
Yeah.
And
Yeah.
that's why I've really been pushing and saying, hey, y'all need to, these are some things that you really need to take into consideration, when that
Mhm.
we really need to take care of ourselves and take care of our lives. So that when I said that I started a campaign about 2004, when I started to speak to people one on one. So I would only speak to you
Yeah.
one on one. I would speak to you one on one, one on one. And I did that for about 17 years. And I would only speak to you. I'll see you, and if I know you, I'll tell you, I'll say, you need to, here's some things you need to think about. And but I dare
Yeah.
not say it publicly. But,
Mm-hmm.
I remember going through the ordination process to become a minister.
Mm-hmm.
And it was, to whom much is given, much is required.
Yes.
So to whom much is given, much is required means that if God has saved you, God has saved me. It's my
Mm-hmm.
testimony. I can't sit down behind closed doors and tell you and you and you and you. I have to come
Mm-hmm.
out and say something publicly, because there were persons who I know died as a result of
Yeah.
cervical cancer. And what I was researching one night, and when I came across some statistics from the World Health Organization, it said that 600,000 women were diagnosed with cervical cancer, and 300,000 women died globally of cervical cancer. And I remember sitting back and I said, what are you saying? And I hear thinking that, you're something you think it's just you alone.
Mm-hmm. It's just
Just
me.
alone.
Mm-hmm.
And I continued to read. And then when you look at the statistics from PAHO, it said, oh, by the way, 335,000 women are diagnosed globally in the Americas and the Caribbean, and
Mm-hmm.
24,000 die. And I said, and I am alive,
Mm-hmm.
living proof that early detection, it saved lives. I know that early detection, it not only save lives, but it saves you money.
Mm-hmm.
It saves you that mental self.
Mm-hmm.
I said, okay, I have to find a way to help, to say something, because I want to be a part of what the World Health Organization is doing, because they're saying that this, by 2030, they're trying to minimize and get the numbers down. So they have accelerated the program where they're talking about, the women and the boys, the girls and the boys need to get vaccinated, because you see cervical cancer, even though it's caused, one of the causes would be HPV.
Mm-hmm.
Boys would be seen, or males would be seen, as the carriers of the HPV virus. So too, they get the penile cancers. So here am I thinking, it was just cervical cancer and that's it.
Yeah. Yeah.
That's what I was just thinking alone, because I wasn't really doing any research on it per se over the years that I was behind closed doors going through the trauma, because I was going
Mm-hmm.
through things like mental the mental
Mm-hmm.
because when you've lost your you don't have your womb as a result of, because it's not like you lost your womb because it may be a prolapse, you have a prolapsed vagina, or maybe because of heavy bleeding, or it is seen, for me it was seen as, oh boy, you lost your womb as a result, you
Yeah.
know you understand what I'm saying? So how could I come out and say something? Because for me, I saw it as a stigma, because
Yeah.
it meant that society, growing up, society would say to you that, there's a thing called barren, and when you hear words like barren, it kind of make you. I used to see women laughing after other women as a result of
Mm.
those things. So how can you come out and say things? And for me, I remember there were some women who would meet me and say, "But Arlene, you married now, you don't have no children for your husband."
Mm. Yeah. Yeah.
And that's when the conversation changed
Yeah.
for me, because I then would say, I have children, my husband has children, we got married, we have children together. But now, because it's my responsibility to
Yeah.
help others, because God has saved me, I have to
Mm-hmm.
share that information, share that testimony to help others so
Yeah.
that they can experience long life, just like how I have been able to experience long life. So, no, fix, live, win. I decided, you know what? That's a campaign that I need to come out with, and but I need an international platform in which to do so,
Mm-hmm.
because I need to make a big thing of this, because this is a serious thing that we're talking about, because it's a
Yeah.
lot of women who are dying.
Mm-hmm.
And that's where I started to align myself with
Yeah.
WIN
Mm-hmm.
BVI, which is Women in Need organization in the British Virgin Islands. Because what happened there was, you see, you would become a the candidate, Mrs. British Virgin Islands, and then you would travel onto the globe for the Mrs. Globe pageant, where you would meet many, many women from many places across the globe, all the places that I've been reading about through the World Health Organization. And then I can share my story with them, and then they can share the story. And then you see that's how information passes on.
Yeah.
I really went to the pageant because I wanted to make an impact in that I want you to know what's happening to you, so you can fix what is happening to you, so
Mm-hmm.
that you can live afterwards, because you got to fix a thing so that you can live. And then when you're living, you can continue to win. And the winning part means you're sharing your knowledge with that of others. You're paying it forward so that they
Mm-hmm.
then can help others.
Yeah.
And that's what
So
this is
how
about.
and I know, I from other interviews I've watched with you, it's like this is something that you are so passionate about. I was also there for the presentation at Rotary. So I want you to share a little bit about that, because I think also, again, what was so awesome is your husband's support as your partner in all of this. And again, as you've said already, this is impacting not just women but men, and as a result, no, families and our wider community,
Yes.
in a very a major way, when we think about it. And one of our viewers already said that, it's unfortunate that, there's always been more, I guess, talk around breast cancer, more education and awareness around breast cancer,
Hmm.
not knowing that, cervical cancer is essentially been moving through like a silent killer,
Yes.
at a
Yes.
very rapid rate. So let's touch on, yeah, so share with them about your husband, and how he's been encouraging you and partnering with you on this. And then we'll probably start to talk more about the disease in terms of helping persons to understand once we cross over the half-hour mark.
Okay, so with my husband, one of the things that I did first, when I saw the statistics, I did say to him, I said, babes, I really want to say something publicly, and I have to say something publicly. And he said to me, which was surprising for me, he said, you do what you have to do. I keep it out of God business. So you do what you have to do. Because what I wanted to make sure that he wasn't going to be embarrassed with what I was about to say. Because I met my husband about a year after I became a cancer survivor. So he met me going through the treatment process, where every 5 years, because once you're diagnosed, right? The first thing that
Mhm.
happens, once they give you that ticket and they tell you, okay, you're good, but we want to see you every month,
Mhm.
then every 3 months,
Okay.
then every 6 months, and then every year. So for 10 years, I've been going back and forth, checking every for 10 years. I've been going once a year, every year. So in 2017, I think 2017 and 2016 was when the doctors told me, okay, it's now okay for you to return now to a regular doctor.
Mhm.
So they
Mhm.
they they, they sign that check mark and say, you can, it's okay now for you to go forward. And my husband has always been that support, that support behind of me. As a matter of fact, when he proposed to me, I wanted to make sure that he was sure. So I took him with me on one of the trips so that
Mm.
he could see what I would have to go through.
Mm-hmm.
And so he saw the big machines, and I have to drink the proper solution, and he just sat there reading a book while I was in the big machine being scanned, and he sat there for hours because he would be there for a long time, eh? And he just
Mm-hmm.
sat there just reading, 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 and I was waiting for him to get up and go to leave, but he didn't. And I think one of the most amazing things for me was when we got married, we agreed that we wouldn't have a reception.
Mm-hmm.
And I was agreeing, not knowing. I thought, we weren't going to have the reception because at the time it would have been better to travel, just traveling and go abroad,
Yes, spend the money on the
marry and
honeymoon.
you
Yes.
get married and you just whisk off without having the
Uh-huh.
party, you just whisk off into the sunset
Mm-hmm.
and you'd go for your honeymoon. And it wasn't until I invited my husband to be present with me for we're having a discussion on hysterectomy talk. This
Mm-hmm.
is where I had a public event where women came and men came to talk about hysterectomy. So you don't have your womb, now what? For those of you who have to make the decision about living without the womb, now what? And my husband and I were being interviewed by Kathy for that interview. And that's when my husband said, we didn't have a reception because I didn't want people to talk on the wedding day about a bouncing baby. Because you
Mm-hmm.
see, at that time, obviously, I can't have any
Yeah.
children. So he didn't
Mm-hmm.
want that our wedding, a day that we're supposed to think on for the rest of our lives, to be marred by
Mm-hmm.
where's the baby? Where's the child? When is it coming? When is it? When is it? So he decided, and no,
Yeah.
we're not going to have any reception, reception at
Yeah.
all. So if persons had
Mm-hmm.
anything to say, they would write it in on a piece of paper, a
In
paper
a
that we
card.
provided, and they would put
Yes.
it in the box, and then we come back, then we would read it. And can I tell you that when we came back, that's exactly what was on some
You
of the
want
paper
the card.
that they're looking forward to seeing this. But my
Well,
husband,
well,
uh,
no, I'm about to say it's almost like that's traditional. It's like first it's where's the husband? Then you and I would have gone through this growing up. Where's
yeah,
the husband? And then
yes,
the husband comes, it's where's the children? So it's always, this demand on you for something else.
yes,
And again, persons don't understand sometimes the emotional toll it will take because again, you are only sharing your story, with your inner circle,
yes,
which would have probably been very small. So you imagine
very
how other people, meaning well would be, all night whispering in the air, we're looking forward to seeing the little feet running around and
yes,
not knowing, the level of trauma essentially you have already gone through
yes,
to even be here to this point. So it's something where again, it's important for us to have these kind of conversations to sensitize people
yes,
because it's like say things and don't understand the impact because again there's always other things that are happening in everyone's life and it's not always traditional or the typical anymore in terms of persons. Every woman is going to have children, is going to be able to
yes.
birth children because of different reasons. you
Yes,
know
and I just want to say that what I've recognized through this experience, you can make the decision if you want to, Shayna. You can make that decision because, for example, I did the radical hysterectomy. There's radical and there's the total hysterectomy, right? Because the radical
Mhm.
hysterectomy means that my ovaries, I still have my ovaries, but they had to remove a number of lymph nodes from around the area, the affected area. And then you have the total hysterectomy. That's when they take out your ovaries, everything. But they left my ovaries in because I was very young. No, that means that I had the option of a surrogate if I wanted to, right? And I remember my husband and I were having a discussion, about it. I asked God to send me a husband who doesn't want to have any more children because obviously I can't have any
Yeah.
more. But then because I knew that I could have this surrogate, I had my sister was standing by, as a matter of fact, um,
Mm-hmm.
to be that person, and we did an experiment one night, you know, because I realized that at one point I was feeling pressured by people.
Mm-hmm.
And we did an experiment one night, and we kept one of the grandbabies. And listen to me, Sheena, when that grandbaby started to cry, I look at my husband look at me because we were in the middle of sleep. I look at my husband, he look at me, and I'm like, not me, able with this hair. So I, not me able with this because I already went through this, and I don't want to go through this
Mm-hmm.
again. With the raising a little
You
baby.
realize how content you are with your life at that point.
Yeah, yeah. So that in itself is what helped me to sort of get over that hump of, Arlene, you have to be satisfied and you must learn to be content, and you
Mm-hmm.
cannot allow society to sort of pressure you into doing things what you ought not to be doing. So I'm really thankful that even for Mrs. Globe, he has been there every step of the way, pushing, helping to push the campaign. When you see, I had events because what I did, one of the things that I did was to make pap smears available for free for women through the Win BVI organization. So what I did was I raised funds. The first time I raised funds, I had like a soiree, and then I
Mm-hmm.
sold tickets. And my husband probably sold, maybe I would say probably 80% of the tickets. 80% of the tickets, and all the tickets were actually sold, and he was there pushing and educating people, the people about cervical cancer. And I
Mm-hmm.
think this is important because, families are affected. If I'm affected, it means that the children are affected. And this is why I'm doing what I'm doing, Shayna, because I don't want that years that when you look down the road, if you have so many women losing their lives as a result of cervical cancer, and if you have so many women who are losing their womb as a result of cervical cancer, what does that say for reproduction later on for our territories? What does it say about life later on? So these are some things that we really need to take into consideration, because I don't want women to go through what I had to go through. So I'm trying to help, especially the younger ones. I visit the schools from time to time so we can talk about the importance of just loving you, self love. It's important, because if you love you, because if I love me, then a lot of things that had happened to me in back then wouldn't happen if
Yeah.
I truly had loved me. And that's what the word says to us. The word says to us, love the Lord your God with all your heart, your soul, and your mind. It said, love your neighbor as yourself. The problem was I was loving everybody else except me. But if you don't love you, then you don't know how to treat others. So that's what
Yeah.
my No Fix Live Win is about. Loving you so that you can and understand the importance of taking care of you.
Yeah. Mm-hmm. That's it. That is the long and short. The how has the reception been? Because I'm pretty sure there probably are those that are still shy about speaking about this, and again, having the annual, and it's not annual, no, it's what, every 3 years,
Yeah, this,
because
you know,
the information seems to be changing now over time. So help us out.
when I started the campaign and I did the first set of pap smears, I realized something came out and said, it's going to be every 3 years. And I know that it created a little frenzy for people, but scientifically, that is what it said, that every 3 years you would do your pap smears. But there are women who want to do their pap smears annually. Now, every year for the last 2 to 3 years, I've been
Mm-hmm.
doing the my No Fix Live win, the free cancer, the pre-cervical cancer screening pap smear initiative. And I must say that we've been getting a number of women who, and even men who call in on behalf of women to sign up. And this
Mhm.
happens in January.
Mhm.
Actually, the first time I did it happened in somewhere in November, December. And then I did another one a couple months after. But then I did a huge one where Unite BVI came and said, we appreciate and we really love what you're doing and we want to be a part of this. And then they teamed up with the Win BVI organization to help push me so that we could make pap smears available to women. So what I've been working on, where I would partner with other
Mhm.
with the private sector in terms of
Yes.
the clinics through Win
Mhm.
BVI organization. We would partner with them so that women have a choice of whichever clinics they want to use. They
Yeah.
would sign up. There's a sign up process. This happens in January because
Okay.
January is Cervical Cancer Awareness Month. So we do that in January, and then in February, the women will then get tested. We will go through the screening. They would have free consultation as well, and we would foot the cost of everything. They just walk in and then walk out. You get your results and whatever the results, and then obviously they would have discussions with the doctors even further. But what I really loved, I had an opportunity to be on the receiving end where I would have been working with persons as well. So in terms of working with persons and listening to them, we have been able to sort of do. They would work with their doctors at a deeper level
Mhm.
to understand what is really happening, because sometimes what will happen, they will have further discussions with their doctors, because if you're at risk, then you and your doctor will have that additional
Okay.
discussion. So what we
Conversation.
always try to do is to do the first step. Just
Okay.
make sure that the pap smear, that this process it's available to
Okay.
people, and
Mhm.
then whatever else needs to be done after that, it would be between you and your doctor. And if there's a situation where there's this cancer or anything, that's where there would be discussions as well with the BVI Cancer Society.
Okay. And we have a question from Facebook asking about CH125. I'm guessing this is some type of cancer screening test because pap smears, what they're saying is pap smears don't always detect cervical cancer. What about the CA125? Are you aware of that?
I'm not too au fait with the I would say the medical part of things. So that's why
Okay.
sometimes what we do, we have based on what the pap smear screenings, what it would say for an individual. This is
Mhm.
where the deeper conversation happens between the individual and the doctor, so that the doctor can have that further discussion with the individual. Because
Yeah.
I know for me, I know you're at risk at all times, so you would have that deeper conversation to make sure that you may have to go through some extra screenings
Yeah.
that a person who would have a normal pap smear may not have necessarily have to go
Just
through.
show anything. Okay.
Yes.
Okay. And also, just for clarity, for viewers that may have tuned in late, Dr. Penn is not an MD. She has a doctorate in philosophy. So, some of the medical questions that you may have, again, we want to encourage persons to have that conversation with their general physician or their OBGYN. So, again, make sure that you have the information, the right information that you need. And family history also plays a part in this. Am I correct?
Well, that is one thing as well.
Okay.
But there are many many different reasons in terms of how a person, sometimes it's sometimes it's how we eat. That's another
Mm-hmm.
thing that we have to take into
Right.
consideration. So there were so many different things that they were talking to me about. Yes, the blood test.
Yeah.
Yes,
So
the blood
it's a
test is
blood test.
always,
Yeah.
yes, it's
Yeah.
done as well. Yeah, that's
Okay.
that's done as well. So just to remind persons, I am a cervical cancer thriver.
Mm-hmm.
And I believe that sometimes when we have initiatives, or the government or anyone has an initiative, it's always good to get the perspective of the person who would have gone through the experience, because when you go through the experience, sometimes I think it puts you in a better stead to speak to someone else who may be going through the same experience, because sometimes you can talk and people would say, well, you can't talk because you haven't walked a mile
Your
yet.
experience. Yeah.
In that shoe. So that's how I've been able to even work with a lot of women. There's some women who have hadn't a pap smear at all.
Yeah.
Some may not be aware of it. So I've had the opportunity to even go with some women to
Mm-hmm.
the doctor's office, so that they can feel comfortable, because they would ask me to
Yeah.
be present, and
Have
then
the
we would have.
support.
Yes, and
Mm-hmm.
we would have that conversation. So I would use my lunch hour to go in to be there with
That's
with
awesome.
the women, if necessary. And then we would have that conversation about that mental self, because sometimes one of the things that one of the reasons why people don't sometimes go to the doctor is because of affordability.
Mm-hmm.
Affordability. And then you talk about, access, just
Yeah.
not having access to so many things, sometimes access to information
Mm-hmm.
you don't know, but you
Yeah.
need access to information. Nutrition is another part of things that we really need to hone in on, and to think about. So my campaign has always been, it's about the now, how, it's about the how you do the thing, because I wanted to take it a step further, because instead of telling people don't do this, don't do that, don't, because you can tell a don't,
Mm-hmm.
but if you don't show me the
Yeah.
how, and my how would have been in making the tests available for you to go.
Mm-hmm.
I'm asking you to call in to register, because I want to make sure that you are able to get the necessary tests that you need to find out what is happening to you now. Because early detection, it saved lives.
Yeah.
Saved my life. It
Mm-hmm.
saved my life. And that's why I know that it can help others. Now,
Yeah.
Shayna, there's another thing that we have to contend with, because what I've found as well, sometimes we don't like to give the time off to go to the doctor.
Yeah.
We don't like to sometimes, as employers, we're not giving the time off to go to the doctor, or sometimes we are not taking the time off
Mm-hmm.
to go and get the necessary assistance that we need. And then we would say that, I have this pain here and I have this pain there, but you're not checking to see what is causing the
What's going
pain.
on?
And
Mm-hmm.
sometimes it's fear is what creates the challenge, for us, because of the fear. I don't want to find out. And I can tell you, I went through it, because
Mm-hmm.
when I was going through the process of the 5 year testing period, I told them, don't call. I told the doctor, don't call me. Don't call me. Call
Mm-hmm.
my husband. Call him. Tell him what the results are. And I would say to him, okay, if it's good results, let me know. If it's not good, if it's not
Oh, we
good,
got to will call you.
just listen. Because
No,
because
but that's the reality, and I think persons appreciate you being real about this thing, because it sounds good to say let's go to the doctor and
yeah,
get
I
you
mean,
done, but then we're on pins and needles until we get the results, and even
yes,
then we're uncertain. There's a lot of anxiety about getting the
yes.
results, because then it might be something that we don't want to hear.
So it
Yeah.
was like, if something is wrong, I said to him at one point, I said, if something is wrong, okay, you tell me. But if nothing is wrong, then you don't tell me. So I was living. So for times, that's how I got through my year. Because for
Hmm.
a whole year, he wouldn't say anything. So I good. A whole year, I still good. I still
Yeah.
go.
Yeah.
I'm still good. I'm still good, you know. So I just want to really encourage persons to just make sure you just test, go and see what is happening to you, and no matter what it is.
Yeah.
So no is just necessarily about once you know something is wrong with you, you feel that something is wrong in
Mm-hmm.
anything. Your next step is to just go and find out if something, what is wrong,
What's going on? Mm-hmm.
so you can fix what is happening to you.
Mm-hmm.
Because fixing could mean several things. Because the longer perhaps I'd wait, I probably would have had to do the probably radiation or chemotherapy. But no, I only had to stop at the first phase, thankfully. But then what about those? There were women when I went for treatment. I met one woman. They gave her about 2 weeks to live because it
Wow.
had already metastasized, through, it
Yeah.
had gone
That's
through
good.
through
Mm-hmm.
her body. And what do I say to her, you know because here I am, I was at stage 1B1
Mm-hmm. Mm-hmm.
moving, but then
Yeah.
she's at 4. So we don't want to get to 4.
Mm-hmm.
We want to make sure that we're checking now to
Yeah.
make sure that we
Yeah.
are good, we're in good standing. Because the higher the number, the
Mm-hmm.
phase,
The
the
more
less
serious
your,
the
the
situation.
less your chances.
Yeah. For survival.
Yes.
And that's something where again for those viewing online, I just went on Paho's website just to
Mhm.
kind of again bring home the statistics of how serious this is. And Paho is saying cervical cancer is the leading cause of death among women in Latin America and the Caribbean. So, it's not just, again, a individual situation or localized, but this is, across the region. And then you are
Region.
giving us the statistics as far as globally how serious this is. And one of the issues there is also access to being able to screen early, because
Yes.
early detection essentially, as we're saying, save lives. Because
Yes.
it's almost as if 1 in 2, because they were saying over 72,000 women were diagnosed with cervical cancer and almost 34,000 died from the disease.
Yes.
It's almost 1 in 2. So out of the two of us, one of us is going to have it, and I'm going to die. One will
And
survive,
women,
and one,
yes.
and that's in this 24th century. For me, these types of things boggle my mind, Arlene.
But
You
you see,
know,
Shana,
I
if
think we have all access to all this medical care, but like you're saying, if we don't go
we have to
so that
find
we can
time,
know, yeah, then we
we
can't fix.
yeah, we have to make that time. So that's why I'm keep pushing this no fix live win. When I came up with this first and I started to talk about cervical cancer, there were people who were saying, why are you airing your dirty laundry? Or why are you saying this? That thing doesn't even exist. That thing is not any true. People were actually saying that. And then there were some guys who came forward and said, my mother died as a result of that.
Mm,
My mom this, but they never wanted to say anything because
okay.
because you see, you have the stigma that comes with it because you're talking about the
Mm-hmm,
vagina.
mm-hmm.
That's what's happening, so no
Yeah,
one wants to talk
the
about that,
taboo.
the real stuff.
Yeah,
Yeah, but we got to
yeah.
talk about the real stuff if you
Mm-hmm.
want people to live. And I really don't want children growing up without their mothers or
Yeah,
their fathers or their you see what, you see
yeah,
what I'm saying.
yeah.
We want people to live healthy and productive lives so that they can experience, there's an opportunity to experience success because I've been able to experience life.
Mm-hmm,
And I know that others can experience life because who am I? I'm human just like you.
mm-hmm. Yeah, yeah. And that's the first step with again us utilizing platforms. So I was happy when you touched base and was like, Shane, how can I come through? And I was like, when are you available? And let's
Yes.
make it happen, because this is something that essentially is a crisis when we think
Hmm.
about it. And I know locally we don't have the level of statistics that we would really need to know to be able to better
Yeah.
manage the situation. So, it's great that, whether it's through nonprofits like Unite BVI or the private clinics that are partnering with programs like these to be able to say to women, we want you to live and thrive, not just live, but to thrive in your
That's
life. And
right.
even if you want to, find something that it's not the end of your life. And I think that's the
Yes.
other important part
Yes.
that we want to make sure that persons understand. You can be a winner. You can, not just be a cancer survivor, but or a cancer patient, but
Yes.
that you're able to
The
thrive and
advocate
have a healthy life and support other women in their
and
fights.
support other women. Yes. Because a
Mhm.
patient's voice is so important. The
Yes.
patient's story, because look at this. It was before I gave up the crown last year, Dana Farber called me
Hmm.
and said, we would love to, we saw your campaign and we would love to interview you. Now,
Hmm.
for them, I became a success story because
Yes.
that's where I got the treatment from. And then here I am, what, 20
Hmm.
years later, they
Yeah.
can say, they can say to their other patients that, look, we
Yes.
have been able to help here, and here's one of our persons
Yeah.
who,
Yeah.
yeah.
The
So
client.
I found that to me,
That's
that was
powerful.
the most touching
Yes.
to be interviewed and to help
Hmm.
other patients. But I think none was more touching though, Sheena, than the Virgin Islands Icon
Hmm.
Award.
I was there for that too. I'm trolling you.
Because, yes, because you see, when I decided to take this leap of faith, this journey, and it's God and I said, God, it was on the conditions that anything that I win publicly, I have to tell the world that, thanks be to God. That's the reason why I've been able to just live and to be successful in this in oh my gosh, just thinking about it. So when they called my name, the first thing, the only thing I could have said was hallelujah,
Mm.
hallelujah, because hallelujah meant that there's so much work that God has been working on me with this whole cervical cancer. Mentally, how do I put away the shame to help others?
Hmm.
How do I begin to look at my scar without feeling that I'm inadequate and help others so that those women who are going through the same thing, I can help them and say, listen, there's more to life than that. There's more to life than, but look at this, you're living. Look at this, you're breathing.
Hmm.
You can still do, you can still live out your dreams, and you can still live out all the potentials in your life, but you just have to make sure that you are doing the things that are necessary to help you
Yeah.
to become the best version of yourself.
Hmm.
So who knew that when we walked down the aisle in 1993 as graduates, that we knew we were different, we knew we would all have different stories, but who knew?
Yeah.
Who
Yeah.
knew? Because we didn't know what the future was going to hold.
The journey would be
We
exactly.
didn't know. But our journeys, and every journey, I want to say that we must not, never look at a scar as a problem. That's a lesson I've learned. Look at your scar as an opportunity to help others so that they do not have to go through what you've gone through because you went through it for them, so that you
That's what
can
it boils down to. Yeah.
experience.
Hmm.
So you teach people what you know so that they then can help others with what they know.
Yeah. And
Know,
I think
fix,
that's
repair.
important. Live, yes. And I think that is so important because one of the things, sometimes again we think that what we've gone through is not going to benefit someone else. See, I'm sharing. I found you on Facebook.
Oh, yeah.
But yeah, so it really was something that was very impactful. So for those who are wondering, this year we had our inaugural Virgin Islands Icon Award, and Arlene won the
The
award for the
first
category
one.
of spirituality, religion, and inspiration
It was our
for
first
her.
award for the night. Yeah.
And so, it really, again, I believe it really inspired everyone to see the recognition now that was given for, the hard work that you've been doing. Because for some people, even as long as you've been doing this, that it might have been the first time they realize, what this is that you have been doing, and the level of impact that I think it's already had on the community and will continue to have. Because again, it's knowledge is power, and until we
Hmm.
know,
Yes.
we can do differently, we can behave differently, we can make
Yes.
different choices. And I think if there's nothing else that we share tonight as far as takeaways, it's
Hmm.
for persons to, take that one thing from, we have to take care of ourselves and those around us. And to be able to do that, we have to make sure we're eating healthier, we're getting our
Yes.
rest and sleep, all aspects of our health. We have to think holistically.
Yes.
And
You have to.
the physical and inside of things, in terms of our body, we can't neglect. And that tends to be the first thing that we throw out the door, especially as women, because we are
Yes.
always putting others in front of ourselves and taking care of everybody else, and
Yes.
suffering in silence oftentimes.
Yeah.
So
Yeah. And
I
yeah.
applaud you for, again, the boldness in what you're doing to help other women, and for other women now to, again,
Help
latch on to this,
others.
because it might not be for you, but
But
you
for
have a
someone.
friend, you have a relative, that needs this information, to make sure that they're looking out for the campaign, and hopefully, again, across a region, because those statistics, I don't know about anybody else, but they are very frightening when we think about it. And a lot of times, as you're saying, Arlene, we only hear persons are sick, and then that's it. And then,
Yes.
but we never hear what it was. And oftentimes, again, it is a situation of cancer, but the
Yes.
type of cancer may be unknown. And sometimes, again, if we know, then we'll understand that it's very commonplace. It's more common than we think.
Yes.
It relates to what's affecting our health and why we're getting sick.
And I
So
must
as
say,
I said to you in the beginning, we were
yes.
going to blink, and the show is done. So
Yes.
let's start to wrap up. So I'm going to give you the last few, again, whatever information you want to share about how bosses can probably, get in touch with you, find out more information, and anything that you have coming up next that you want to make us aware of.
Okay, well, I just want persons to just always bear in mind that your health comes first, your safety comes first. Persons can look find me on Facebook, but one of the things I want persons to do is to read the World Health Organization, the statistics, read for PAHO as well in your respective countries, get in more involved in your cancer societies that are there, because the cancer societies should have all the relevant information that you will need. Speak to your doctors about all this information about how you can live good and productive lives, especially watch out for the things called STDs and STIs, because those things are on the rise, right, Chena? These are some things that we really
Mhm.
have to consider, because these are things that affects us in the long term. And I want to just say this quickly before I leave, Shana, that remember the Virgin Islands too, we were able to win at the Mrs. Globe pageant, the Voice of the Women in Need global award, because
Mhm.
of the kind of work that I would have put in on the ground before I got there to the pageant. Almost over 100 countries already knew about the cervical cancer, about the campaign, about the No Fix Live Win. So I just want persons to make sure you take care of you, because when you take care of you, then you can take care of everyone else. And if there's
Mhm.
anything that, if you don't remember anything I've said this evening, just remember this: no, fix, live, and win.
Yes. Thank you, Dr. Penn, for being here tonight. Again, thank you to all those who have tuned in, came on, wherever talks, straight across the board through our media partners. Want to say a big thank you to Cayman Mall Road Facebook page, Radio TCI, Montserrat ZJB Radio, Virgin Islands CBN, Radio FM 90.9. Bermuda's Channel 82, Radio Sabre, PJFE, FM 93.9, and Barbados is CBC Channel 8. So again, it's not just, this information isn't just for women, but it is for our men as
Men,
well.
everyone.
There are different aspects to the cancer. We touched on HPV before. So again, all this information is out there available, but make sure you're getting it from a trusted source. And oftentimes the best source would probably be your doctor as a starting point, because they know your health history, they know your family health history, and they can guide you in terms of types of testing, in terms of any additional. One of the viewers had asked earlier about the blood test, because, perhaps they may not show something, but then there's something else that might show up in the blood test. So again, speak with your doctor, your health practitioner, making sure that you're arming yourself with the right information so that we can know, fix,
Fix,
live,
live,
and win.
win.
Yes. So again, thank you to everyone who is tuned in across the different media channels. Thank you, Dr. Penn, for being here with us and sharing your story so passionately. And as always, the platform is here for you to come through and share anytime. Again, because this is definitely a global message. So it's something where we want to make sure that everybody that is willing to listen
Yes.
essentially here. So we appreciate you. So on behalf of my team, Thomas Famous and Shirley Osborne, I am Shayna Smith Archer saying thank you for tuning in to another episode of Territories Talk, where we are always looking forward to inform and unite our overseas territory and Caribbean family. Have a good evening.